Alright, let's dive into this because it's a big deal. Dr. Erica Schwartz has just been confirmed as the new director of the CDC, and personally, I think this is a moment that's worth unpacking. First off, what makes this really interesting is the timing. The CDC has been without a permanent director for nearly a year, and that's not just a bureaucratic hiccup. It's a gap in leadership during a time when public health is under the microscope like never before. From my perspective, this appointment feels like a reset button. But it's also coming at a moment when the agency is facing some of its toughest challenges yet. Now, let's talk about Dr. Schwartz herself. She's got a solid background: Navy physician, Coast Guard Chief Medical Officer, and Deputy Surgeon General under Trump. On paper, she's a conventional pick, but here's where it gets tricky. During her Senate hearing, she didn't exactly distance herself from some of the more controversial stances of Health Secretary Robert F. Kennedy Jr., who, let's be honest, has been a lightning rod for criticism in the public health world. What many people don't realize is that her responses were carefully measured. She affirmed that vaccines are safe and effective, but when pressed on Kennedy's policies, she dodged. That's not a great look when you're stepping into a role that demands clarity and independence. In my opinion, this raises a deeper question. Can Dr. Schwartz truly lead the CDC without being influenced by political pressures? Senator Bill Cassidy, who's a doctor himself, called her out for evading questions about whether she'd challenge Kennedy if he tried to undermine science. And while Cassidy eventually backed her nomination, his initial skepticism wasn't unwarranted. The CDC needs a leader who's willing to stand up to crazy, stupid things, as Cassidy put it, and so far, Schwartz hasn't fully convinced everyone she's that person. What this really suggests is that her tenure could be a tightrope walk. She's inheriting a measles crisis, the worst in 35 years, and a growing outbreak of Cyclosporiasis linked to lettuce. On top of that, vaccine hesitancy is on the rise, and some experts blame Kennedy's rhetoric for fueling it. If you take a step back and think about it, the CDC director's job right now isn't just about managing outbreaks, it's about rebuilding public trust in science. And that's a monumental task. A detail I find fascinating is the modification of the CDC's webpage about vaccines and autism. Cassidy called it a sign of good faith. But let's be real, it's a band-aid on a bullet wound. The page still claims studies haven't ruled out a link between vaccines and autism, which flies in the face of decades of research. This isn't just a technicality. It's a symptom of the broader politicization of public health. And Schwartz will have to navigate this minefield, while also dealing with Kennedy's shadow looming over her. Personally, I think the biggest challenge for her isn't the measles outbreak or even cyclosporiasis. It's proving that she can lead independently. The National Public Health Coalition, made up of former CDC employees, refused to support her nomination because they felt she didn't commit strongly enough to protecting CDC guidance from political pressure. That's a red flag. If the CDC loses its credibility, it loses everything. So Schwartz has to hit the ground running and make it clear that science, not politics, will guide her decisions. What makes this really interesting, though, is the broader context. Public health agencies worldwide are grappling with similar issues: politicization, misinformation, and eroding trust. The CDC's struggles aren't unique, but they're particularly high stakes because of the agency's global influence. If Schwartz can steer the CDC back on course, it could be a model for others. But if she can't, the consequences could be far-reaching. In my opinion, the next few months will be defining. Will she challenge Kennedy's controversial policies? Will she push back against misinformation? Or will she toe the line? One thing that immediately stands out is her statement at the hearing: "I will never betray the science." That's a strong promise, but promises are easy to make. The real test will be in how she acts when the pressure's on. So here's my closing thought. Dr. Schwartz's appointment isn't just about filling a vacancy. It's about restoring faith in one of the most important public health institutions in the world. The challenges are massive, the stakes are higher, and the spotlight is unforgiving. Personally, I'm cautiously optimistic, but I'm also realistic. This is a job that requires not just expertise but courage. And in the end, that might be the most important qualification of all. What do you think? Can Dr. Schwartz rise to the occasion? Or is she stepping into an impossible role? Let me know in the comments below.